First question is for you, Doctor. From Michael Bilo of Motif Magazine. He notes that the New York Times is comparing current reports to historical averages, finding excess deaths in some states. For example, Massachusetts 20%, New York 42%, New Jersey 72%, suggesting both undercounts of COVID-19 deaths and increased deaths from treatable conditions. What has Rhode Island done to estimate this? What was learned?
So I'll want to provide some additional information as a follow-up once we touch base with our data team to be able to say the specific assessments in terms of what our estimates have been and what's been learned. But the high-level understanding is that deaths have unfortunately occurred in some of the states mentioned where they may not have been acknowledged as being COVID-19 associated. And so that's how there can be a concern for undercounting. I will say that we do have a very comprehensive approach here in the state. We very much benefit from the fact that we have one office of the state medical examiners and close relationship with those who are involved in capturing people who have unfortunately passed away. Our first responders are very engaged. We coordinate very closely with our funeral homes. So we do have a process in place statewide to help determine if there was an unfortunate death, can we either just prior to or after the death account for the fact that COVID-19 may have been associated. So while we may have some counts of excess deaths, I would say overall as a state for Rhode Island, we have a system in place that allows us to the best of our ability to capture all of the deaths that have occurred without knowledge of COVID-19 associated with it prior to, but to be able to identify COVID-19 as being associated if it is. We are able to test for that and determine.
Thank you. Governor Scott Barrett of the Newport Daily News says, you mentioned during your briefing Thursday about trying to give students a normal college experience in the fall. Generally, that would include things like attending football games and other events outside of the classroom. Under the best and worst case scenarios, what can students expect to see come September?
It's a great question, Scott, and the answer is we're still trying to figure that out. Earlier this week, my administration reached out to all of the colleges, public and private, in Rhode Island, and asked them to create plans to safely reopen in the fall. And I believe we gave them until the first or second week of June in order to submit those plans back to us. We detailed, in some detail, what a complete plan would have to entail as it relates to social distancing, testing, plans to deal with international students, sporting events, events outside of the classroom, infection control, clean, how they plan to clean, cafeteria. Bottom line is it's a really complicated exercise. I will have a much better answer for you in mid to late June. There's a lot of work for them to do to figure it out. Also, we're going to learn a lot. We will learn a lot together in the next 2 months. So as we get to the place of going back to work, going out for dinner, going to the beach, we're going to learn about the virus, and all that is going to inform what they're able to do in the fall. So it's premature to say, but we're on it and we're working hard on it every day.
Dr. Alexander Scott, Tanya Signori of the RI Echo is asking you to define herd immunity. Do you think eventually we will be able to attain herd immunity here in Rhode Island?
Thank you for that question, Tanya. Herd immunity refers to a large enough proportion of the population having antibodies or immunity against a particular disease that protects enough of everyone else who may not have that protection. Usually the percentage is over 60, 70% of the population. If enough people have been vaccinated against measles, the higher the number, the better, for example. the more protected everyone is as a whole, because you're less likely to have scenarios where someone has measles and spreads it to someone else because everyone is vaccinated against it. We are still learning whether or not we will be able to attain herd immunity here in Rhode Island related to COVID-19 specifically. There's a lot of information still being assessed so that we can learn about antibodies, what the tests can tell, what actually happens in our bodies. And I want to again thank the Rhode Island COVID-19 Testing and Validation Task Force, because they're working on helping us understand specifically those types of answers. What will happen to immunity for COVID-19? Does it exist? We're still understanding that. And will tests even be able to help us gain that information? So we have a ways to go, but we do know the vaccines that are out there that we have. It allows me to say, make sure that your vaccines are up to date, flu and so many of the others, because that herd immunity is valuable for helping to protect Rhode Island as a whole.
Doctor, this next question is also for you from Tony Mendez of Poder 102. What cleaning products that are readily available can you recommend to families that have many members living in their house or apartment to stay safe?
Thank you, Tony. The Centers for Disease Control and Prevention, CDC website, has a variety of recommendations for keeping settings clean. In public settings where there are surfaces that are touched frequently by members of the public, as well as in the home. On a whole, particularly in your home, using the normal supplies that you have to keep things clean, and really thinking about the doorknobs in the house, the bathroom sinks, the kitchen counters, things that multiple people in the house may touch frequently, particularly after coming in from work or coming in from outside, are key approaches that family members can use. We want to keep it as practical as possible, and being able to clean those surfaces once a day at minimum in your home is a great approach at helping to keep everyone safe, in addition to washing your hands and many of the other elements that we discuss.
Thank you. Governor Alan Gabberty of WBOB is asking, after May 9th, what factors would constitute the spike that would force you to tighten restrictions on Rhode Island again, and how long would that spike have to last?
Thank you, Alan. We are working on, that's a piece of work that needs to be completed before I would lift the stay-at-home order, and I'm hoping to be able to make announcements around exactly that towards the end of next week. So we know we'll see some increased cases. We hope and plan that it's not going to be a spike, as you say, because we've gotten used to dealing with this. You know, now we are wearing masks, we are staying home when we're sick, we are staying 6 feet apart. We are not going to just flick the switch and open all parts of our economy. But later next week, I'm going to go into some detail around what we might expect to see, and that is a safe level of increase, and then what fact patterns might get us more nervous, which would require me to have to rein back in, as you say, tighten some restrictions.
Brian Amaral of the Providence Journal, very similar, saying, are you worried that if you have to put restrictions back in place after they're lifted, compliance will be more difficult the second time around?
I certainly think about that, Brian. You know, again, this is unprecedented. No governor has ever had to do this before. No group of Rhode Islanders has ever had to live through anything like this, quite like this before. So, you know, no, I'm not worried. If it happens, we'll deal with it. You know, that's what we've done from day one. We look at the conditions on the ground and we make a plan to deal with it. Rhode Islanders have gotten very good at this. We've all become a lot smarter. You know, we're learning, every one of us is learning every day about the virus, how to keep ourselves safe, what we can do to keep ourselves safe. We've also seen, like, those images of Milan, Italy, or New York City, or other places that have lived through some of the horrible days of this were very real, and we don't want to see that here. So, my faith is in the people of Rhode Island to do the right thing at every stage.
Will nail salons be treated the same as hair salons? This is from Paul Parker of the Providence Journal.
I would say yes and no. So the whole category of what we're going to call close in contact businesses will be reopened in the same phase. Nail salons, hair salons, barber shops, all kinds of, beauty salons. Those are all going to be regulated as close in contact businesses. So yes, nail salons and hair salons will be the same. However, there are going to be very specific cleaning protocols, probably reservation systems, and it might be that there may be some slight differences between a nail salon and a barber shop and something else, and a tattoo parlor. But they're all going to be open at the same phase. Possible differences in some of the cleaning and regulations.
John Howell of the Warwick Beacon asks, are protocols being developed for the reopening of libraries, given that they serve as an important resource to so many different sectors of the community? Families with preschool children, the elderly, people without computers, support groups, and even the homeless.
Yeah, great question, and the answer is yes. By the way, these questions you're asking, this is what we're doing all day, all night, every day right now. The process of reopening our economy in phases under all new regulations is it's a heavy lift. We're going through setting by setting, libraries, nail salons, restaurants, public transportation, retail operations, dentist offices, office buildings, on and on and on, and saying, okay, what does that setting have to look like in terms of social distancing, maybe temperature taking, number of people per square feet, cloth masks required, in order for it to be safe. However, you are correct, libraries are essential for so many people, and we're going to figure out a way to open them safely. Same thing, public libraries, public buses, people need to rely on these services, and so we're going to make sure they can.
From ABC 6 News, Nick Papadilla asks, Governor Raimondo, are you able to elaborate yet more as to what going out to eat and going to the beach may look like for Rhode Islanders as we set to reopen the economy and continue to battle this virus?
So I will offer you some guidance as long as you understand that it is guidance subject to change because we are still working on it. But going out to eat might look like many fewer people in the restaurant at any given time, because again, we all have to stay 6 feet apart. It might look like no menus. It might look like folks still have a mask on some of the time, part of the time. Going to the beach might be, there'll be many fewer people who can go in the parking lot at any given time. We might have a reservation system. You might have to reserve a few hours at the beach. There might have to be like porta potties instead of fully opening the bathroom facilities. So these are all, I'm just trying to give you a flavor for the kinds of things we're thinking about, but I will have a lot more to say about that the week after next.
Lynn Arditi is asking, Governor Raimondo, despite aggressive testing, Rhode Island's nursing homes and long-term care facilities account for more than 70% of COVID-19 related deaths in the state, higher than any other state in New England. Why is that, and how is the state addressing it?
Yeah, so I will answer that, and then I want to give the doctor a chance to answer that. Why is that? You can look at that in one of two ways. The good news is we've had a good experience with mortalities and hospitalizations in non-communal settings. The experience all over the world is that the highest risk scenarios are communal living scenarios, and then on top of that, communal living scenarios where you have people that are frail and that are old. So, you have to take that into account. I think what I can tell you, what are we doing to address it? I mean, if you look at what's happening in our veterans home and compare that to other states, we are doing meaningfully better. And I don't in any way want to minimize what's happening, which is why I'm choosing my words very carefully. One death is a terrible thing. One person getting sick is a terrible thing. But what are we doing is, we are on it right away in that veterans home with extra PPE, extra testing. Within 3 days, we tested every resident and every staff member. We quarantined the people immediately. We had ingress and egress specific doors to people who treated the COVID patients. We are really ramping up our efforts for mobile testing of people in nursing homes. We have set up a National Guard special support team targeting and going into nursing homes that need extra help. We're setting up specific COVID positive nursing homes. We're providing extra PPE for residents of nursing homes. We're providing wage supports for the lowest wage workers in nursing homes. So we're doing everything we know how to do. We're getting better and stronger at it every day. And unfortunately, just a really terrible and sad reality of this virus is that it's hardest to control in communal living, and sadly has the worst impacts on the frail, the compromised, and the old. You want to add anything?
The governor really answered fully in a very tough scenario that we have and every other state has. And we'll again reiterate that Rhode Island has the highest population of people who are older than 85. And even just hearing today, I mentioned 5 people in their 80s, 5 people in their 70s, 4 people in their 80s, 4 people in their 90s. Not every state has such a robust and long-living population that we have in Rhode Island. And this is our topmost priority, being able to address the fact that we have a precious older population and a virus that transmits very easily when people are close together and are vulnerable because of being medically fragile or physically fragile. So it's an unfortunate scenario, but as the governor has mentioned, we have all hands on deck to do everything we can in our state, given that population data point that I shared, to control this and address it.
Our last question for the Saturday briefing is from Nancy Thomas of RI News Today. Can you give us a total of deaths in nursing homes and in other congregate settings of all 296 fatalities to date?
Yes, I do have that data here on my page. We, have been impacted broadly by this. Even just among the 17 unfortunate deaths that we had today, 15 people lived in congregate living settings. And regarding overall deaths among nursing homes, I will be able to share that by the time we have the call afterwards, Nancy, so that I have that data correctly for you. But I do want to take the opportunity to acknowledge how tough it is. The number of unfortunate fatalities we have, each person matters, each family is impacted. And for those who are in nursing homes or congregate settings, they actually have 2 families. They have their own blood relatives, and they have the family of the people in the nursing home or the congregate setting who dedicate their careers to taking care of them. So we recognize that there are a bunch of people who are hurting. If you can just imagine the family of the staff in nursing homes, they are continually facing the fact that we are discussing this every day. So, as all Rhode Islanders keep These people in our thoughts and in our prayers, and as the media appropriately inquire, so we have the numbers in place. Let's remember what our nursing home staff and administrators are going through as well as a family caring for those who have passed away, while we all do what we can to help decrease that from happening. So I'll have those numbers updated for right after, but just wanted to share that. Thank you.
Thank you, Doctor.